Welcome, class. Today, we will be diving into the fascinating world of radiology and exploring various advanced imaging techniques used in magnetic resonance imaging, MRI. This script will provide you with a comprehensive understanding of these techniques and their clinical applications. So let's get started. T1 weighted imaging is a fundamental MRI technique that provides excellent anatomical detail and contrast. It utilizes a short repetition time, TR, and a short echo time, TE, resulting in a bright signal for tissues with a short T1 relaxation time, such as fat. Tissues with longer T1 relaxation times, such as gray matter and muscles, appear intermediate in signal intensity, whereas fluids and background appear dark. T1 weighted images are commonly used for anatomical evaluations, detecting lesions, and assessing the presence of hemorrhage. Moving on to T2 weighted imaging, this technique employs a long TR and long TE to enhance the visibility of tissues with long T2 relaxation times, including fluids. Tissues with shorter T2 relaxation times, such as bone and air, appear dark, while those with longer T2 relaxation times, such as white matter and edema, appear bright. T2 weighted images are particularly useful in identifying pathology, evaluating inflammation, and characterizing certain neurodegenerative disorders. Inversion recovery sequences involve the use of an inversion pulse to selectively null the signal from specific tissues. By applying a specific inversion time, T, the desired tissue can be suppressed, providing enhanced contrast with surrounding tissues. This technique is commonly used for imaging lesions, like multiple sclerosis plaques, by suppressing the signal from normal brain tissue. Echo-planar imaging is a fast imaging technique that allows the acquisition of multiple images within a single echo. It is particularly suited for functional MRI, fMRI, studies, as it enables the rapid acquisition of images over time. EPI is widely used to assess brain functional activity by tracking changes in the blood oxygenation level dependent, BOLD, signal. Turbo spin echo is an accelerated imaging technique that combines the advantages of fast imaging with the excellent contrast obtained from conventional spin echo sequences. By utilizing a train of 180-degree refocusing radiofrequency pulses, multiple echoes are generated within a single excitation. This technique significantly reduces scan time while providing high-resolution images, making it suitable for evaluating musculoskeletal and central nervous system pathologies. Balanced steady-state free precession, also known as true FISP, is a cine imaging sequence that exploits the steady-state signal behavior of protons in a magnetic field. It provides high contrast between tissues with different T1 and T2 relaxation times. BSSFP is commonly utilized in cardiac imaging to study myocardial function, assess cardiac anatomy, and detect various cardiac pathologies. Diffusion tensor imaging is a specialized MRI technique that measures the direction and magnitude of water diffusion within tissues. By acquiring multiple diffusion-weighted images, DTI enables the visualization and quantification of structural connectivity, such as white matter fiber tracks in the brain. It has extensive applications in studying neurological disorders, brain development, and traumatic brain injuries. Susceptibility-weighted imaging is a high-resolution technique that exploits the differences in magnetic susceptibility between tissues. It provides excellent visualization of venous structures, microhemorrhages, and iron deposition. SWI is particularly useful in the assessment of neurovascular malformations, traumatic brain injuries, and neurodegenerative conditions such as Alzheimer's disease. Silent MRI techniques aim to reduce the noise generated during image acquisition, improving patient comfort and expanding diagnostic options. They utilize modified pulse sequences, specialized gradient designs, and parallel imaging techniques to minimize acoustic noise. Silent MRI is beneficial for young children, claustrophobic patients, and individuals with hearing impairments. Blood oxygen level dependent imaging measures changes in tissue oxygenation based on the magnetic susceptibility of deoxyhemoglobin. By detecting alterations in oxygen levels, bold imaging allows the mapping of brain activity during functional tasks. It has revolutionized our understanding of cognitive processes and is widely used in neuroscience and clinical research. Spectroscopic imaging is a valuable tool that enables the assessment of chemical composition within tissues. It measures the resonance signals of different metabolites, such as choline, creatine, and N-acetylaspartate, providing invaluable insights into tissue metabolism and function. Spectroscopic imaging has applications in oncology, neurology, and monitoring treatment response. Parallel imaging techniques use multiple receiver coils to accelerate image acquisition. By exploiting the spatial information from the coil array, it reduces the number of phase encoding steps required for image reconstruction. This results in shorter scan times and enhanced spatial resolution. Parallel imaging techniques are employed in various clinical scenarios, including cardiovascular and musculoskeletal imaging. With the advancement of technology, MRI continues to evolve, offering a wide range of imaging techniques that have revolutionized medical diagnostics and research. Each technique we discuss today plays a crucial role in different clinical settings, providing valuable information for accurate diagnosis and patient management. As future radiologists, it is essential to have a strong foundation in these advanced imaging techniques to provide the best possible care to our patients. That brings us to the end of today's lecture. I hope you found it informative and engaging. Please review the material covered, as it will be significant for your future clinical practice.